So if you found a breast lump, it's better to go to a medical oncologist than a breast surgeon. Is that true? I would think yes. Vast majority of breast lumps or basically breast cancers which are screen detected. When I say screen detected, that means the patient did not have any symptoms, no breast lumps, no discharge, no skin changes. Then usually you associate that with a very small tumor, and irrespective of the receptor status, usually they go down the pathway of upfront resection or surgery. But let's assume that you are a younger patient, then the chance of having this garden variety hormone positive breast cancer is no longer the default option. You might be having some aggressive cancers such as triple negative breast cancers, and another cancer called HER2 positive breast cancer, which is my subspecialty if I can call it. These are associated with poor prognosis, especially in the era when there was no targeted treatment available. So the chance of having a much more aggressive nature of disease is higher if you're diagnosed with a breast cancer, say under the age of 50 years. Or if you find a lump, obviously, that means you are looking at a much more larger tumor to deal with. Why it is beneficial to go to a medical oncologist is because we will try to assess whether giving upfront treatment with chemotherapy and targeted therapy is actually beneficial. So for instance, if you are looking at triple negative breast cancer, one of the biggest paradigm change in terms of triple negative breast cancer is that unless it's a very small tumor. So when I say small tumor, I'm looking at a 20 millimeter or 2 centimeter tumor. That's a small tumor. Majority of the time 2 centimeter or below, and there are no lymph nodes involved, you would actually go for an upfront surgery. But if you're having a HER2 positive breast cancer or a triple negative breast cancer, and if it is more than 2 centimeters, I'm actually looking at the NCCN guidelines, newest version in 2025 as we speak, and when they look at it, over the 2 centimeter mark, if you've got HER2 positive breast cancer or triple negative breast cancer, upfront preoperative systemic therapy is always preferred for 2 reasons. Number one, it gives you a very good idea about the prognosis of this cancer. Let's assume that you actually give upfront chemotherapy and a targeted therapy combination for these HER2 positive breast cancers and triple negative breast cancers. You get valuable information whether the treatment is actually working or not, because if you do the upfront surgery, you will actually be giving this treatment after the surgery, so you have no idea of knowing whether this treatment works or not. So that prognostic information is very good. And the second thing is the cosmetic outcome, especially for a larger tumor, is significantly better if you actually give preoperative treatment. That means preoperative chemotherapy and a combination of targeted treatment before, and you get better surgical outcomes, better cosmetic outcomes by doing that, because you are actually expecting the tumor to shrink. So I would think, so the message here is pretty simple, especially if you're a younger woman or having symptomatic breast cancer with a breast lump, it's always better to actually consult a medical oncologist probably first or at least parallelly to see what are your best options in terms of systemic.